Hi, welcome to Professional Certifications channel. Let's break down NCLEX exam preparation, one topic a day for focused and effective learning. Today's topic is oxygen therapy.
What is oxygen therapy? Oxygen therapy is the administration of supplemental oxygen to patients who have low oxygen levels in their blood, a condition known as hypoxemia. It's used to treat a variety of conditions, including chronic obstructive pulmonary disease (COPD), pneumonia, asthma, heart failure, COVID-19. The goal of oxygen therapy is to maintain adequate oxygen saturation levels, typically above 90 to 92%, to ensure proper organ function and patient comfort.
Types of oxygen delivery devices. There are several types of oxygen delivery devices, each suited for different patient needs and oxygen requirements. Let's break them down. 1. Nasal cannula. Delivers low to moderate oxygen levels, 1 to 6 liters per minute. Ideal for patients who need mild oxygen support. Comfortable and easy to use. 2. Simple face mask. Delivers moderate oxygen levels, 5 to 10 liters per minute. Covers the nose and mouth. Used for short-term therapy or higher oxygen needs. 3. Venturi Mask. Delivers precise oxygen levels, e.g., 24%, 28%, 35%. Ideal for patients with COPD who require controlled oxygen levels. 4. Non-Rebreather Mask. Delivers high oxygen levels, 10 to 15 liters per minute. Used for patients with severe hypoxemia or in emergency situations. 5. High-flow nasal cannula, HFNC. Delivers heated and humidified oxygen at high flow rates. Used for patients with acute respiratory failure.
Step-by-step guide to administering oxygen. Now, let's walk through the steps of administering oxygen using a nasal cannula and simple face mask. 1. Assess the patient. Check the patient's oxygen saturation using a pulse oximeter. Assess their breathing pattern and overall condition. 2. Choose the right device. Select the appropriate device based on the patient's oxygen needs. 3. Set up the oxygen source. Connect the oxygen tubing to the flow meter. Adjust the flow rate as prescribed, e.g., 2 liters per minute for a nasal cannula. 4. Apply the device. For a nasal cannula, place the prongs into the patient's nostrils and secure the tubing around their ears. For a face mask, place the mask over the patient's nose and mouth, and secure the elastic strap around their head. 5. Reassess the patient. Monitor the patient's oxygen saturation and comfort level. Adjust the flow rate if needed, following the healthcare provider's orders.
Safety precautions. Oxygen therapy is generally safe, but there are important safety precautions to keep in mind. No smoking. Oxygen supports combustion, so smoking or open flames near oxygen equipment can cause fires. Humidification. Use a humidifier for high flow rates to prevent drying of the nasal passages. Skin care. Check for skin irritation under the nasal cannula or mask, especially in long-term use. Device maintenance. Regularly inspect the tubing and connections for leaks or damage. Monitor oxygen levels. Avoid overoxygenation, which can lead to oxygen toxicity, especially in patients with COPD.
Troubleshooting common issues. Sometimes, issues can arise during oxygen therapy. Here's how to troubleshoot. Low oxygen saturation. Check the flow rate, ensure the device is properly fitted, and verify the oxygen source is functioning. Dry nasal passages. Use a humidifier or saline spray to keep the nasal passages moist. Skin irritation. Apply a protective barrier cream or adjust the device for a better fit. Tubing disconnection. Regularly check the connections and secure the tubing to prevent accidental disconnection.
Conclusion. To wrap up, oxygen therapy is a life-saving intervention that requires careful administration and monitoring. By understanding the types of devices, proper techniques, and safety precautions, you can ensure effective and safe oxygen delivery for your patients.